Everyone, welcome to my YouTube channel. I'm Ayesha. I'm a third year medical student, and in today's video I'm going to talk about microbiology, how to approach the subject, how to study it in a smart way, not just how to pass the exam, but how to actually understand the subject and apply the concepts in your third year, in your fourth year, and how to study basically. So before we begin, let's understand why this subject is important. So this is one of the most core subjects in medicine. Actually, all the second year subjects, which is your path, which is your micro, which is pharma, all are going to be integrated in your fourth year, in your third year, and especially in your clinical postings. All these three subjects are going to help you a lot, and this is micro is one of the core subjects in medicine, and it's also going to help you in SPM, which is community medicine, to understand different epidemiology of diseases and prevention of diseases, vaccinations, how they work, and outbreak investigations, public. Now that I'm in third year, I understand how important micro is. So please study all your second year subjects in a good way, understanding the concepts. Don't just read them for exams, but actually understand them. Let's begin with what resources to use. So I personally used Essentials of Medical Microbiology by Purva and Sandhya. If you want to use any other book, mostly professors recommend Anant Narayan. I've never used that book, so I can't vouch for it, but because I have used this book and I'm planning to make videos on microbiology, I'm going to be using this book and Panikkars for parasitology. But for my second year, I entirely used this book. Everyone in my class has used this book. Buy it. It is going to help you a lot. Use a physical copy. I have a PDF as well, but I would say if you can, then please buy this book. So now that we are done with resources, you can also use your class notes. If your professors teach you well, then you can annotate in your textbook, but I think this is totally enough for the exams. Okay, let's begin now. So step 1 is your basics. I cannot stress enough on the basics. Please study these well. Your general microbiology, starting with the scientist names, etc. That will help you maybe in MCQs or something like that. After that is the main part, which starts with like your bacteriology, your virology, mycology. So when you're doing your bacteriology, let's say, focus on this page in Apurva Shastri. It's gonna be at the beginning after your chapter section index. This page where all the organisms are listed. This, I cannot stress enough on this table. I love this table. It's just because the new Apurva Shastri, it is system wise, it's not organism wise. So a lot of students, they forget to correlate organisms. So when we look back at it while we are also doing our systemic study, which I'll come to later, but when you are doing your basics, do not ignore this section. Keep looking at it from the beginning of your year. So while you're doing your general microbiology, read all the microorganisms and their classification. Okay, so try to memorize these. I'm gonna make videos. I'll make mnemonics on how to remember these, how I remembered them, how I memorized them. So what I did was here, I love how Apurva has given which chapter each organism is mentioned in with the page number, so it's so easy for you to refer. I have personally made my notes based on this. Let's say Staphylococcus aureus. So it's present in cardiovascular system, in skin, in GIT, it causes pneumonia, it causes urinary tract infection, and yeah, like that I have listed out all the organisms with what they cause. So this will help you at the end of the year to revise. So let's get back to where we were. So basics, please focus on this section. Like I said, I cannot stress enough, it will help you a lot. Now after microorganisms, what is very important is your lab diagnosis. Your entire microbiology, all your marks are relying on this one section. So when you're doing your general microbiology, do the lab diagnosis section in a very smart way. There's a table at the beginning of every lab diagnosis chapter. Let's say there's bacteria section. Open your textbook and see that in the beginning, before discussing all the lab diagnosis in details, Apoorva has given a table with all the side headings or what kind of lab diagnosis are required for bacteria, for virus, for fungi. So write them down in a sequence, because when you get into systemic microbiology, it's going to help you. So basically systemic, let's say CVS, it is divided into 4 parts. First they'll talk about bacteria, then they'll talk about the viruses, I guess, then your parasites, then fungi. So let's say when they're talking about the bacteria, they are going to like write the lab they're going to discuss the organism at first, then there's going to be a section called lab diagnosis, and in the beginning of that lab diagnosis is going to be one table. That table will correlate a lot with what you studied in general microbiology. So relate this lab diagnosis with what you're gonna get in systemic. You will understand once you study the subject. Okay, next, once you are done with your basics, we start with the immunology and hospital infection control. Do not ignore this section. Immunology is there in both microbiology and pathology. Personally, I did the microbiology section first because it talks about the basics of what an antibody is, what an antigen is, what an antigen-antibody reaction is, and then it's going to talk about your hypersensitivity reactions, which are common to both micro and path. So try to study the immunology for micro and path together. Do micro first, then pathology, or whichever way you like, honestly. There's one chapter called antigen antibody reactions, which talks about tests like ELISA. I guess you guys know about what ELISA is. So ELISA is used for a lot of lab diagnosis. So this section is very important because it's going to help you in your lab diagnosis, which again is here. Okay, so after you do this basic lab diagnosis, I would say go to this chapter so that you can understand what other lab diagnostic methods exist. Okay, and then you can do your basic immunology, which is your antigens, antibodies, and so on. Next is your hospital infection control. Just read the textbook. It is very logical. It is also memorization based, and the important topics in this is the biomedical waste management. Oh, I wrote BMV. Biomedical waste management. Okay, so this is a very important section. You are going to be asked a lot of Viva questions from this chapter as well, like which color bin, what waste goes in, what does red bin take, what does yellow bin used for, and so on. So this is very important, not just for your exams but for your Viva, and when you are in the hospital you see these colored bins everywhere. So what goes where, this is very important for your clinical practice. And there's this stupid chapter called sterilization and disinfection. You try to read the textbook and understand this chapter, and if you do not understand something which is in the textbook, I would say use AI like ChatGPT or use Gemini and ask it to make it into points or to explain it to you in a better way. That's what I did for this particular chapter. And then there's this topic called as hospital acquired infections, HAIs, which has catheter associated urinary tract infections and bloodstream infections, surgical site infections. So these topics are also important in this section. So in these topics, what is very important is again the causative organisms. So when you're doing this, what I want you to do is go back and look at what do those causative organisms fall into. Are they bacteria? What kind of bacteria are they? Are they gram positive? Are they gram negative? Or what are they? Bacilli? Are they cocci? This is again going to help you understand the organisms in detail. And why I keep stressing on this is because once you get into pharmacology as well, at the end there's this chapter called antimicrobials. In that you learn about different types of antimicrobial agents. So there you'll study that these antimicrobials, let's say penicillins, are effective more against gram positive organisms. Now when you don't know what gram positive organisms are, how will you understand where penicillin is given, right? So I cannot stress enough on this section, so please do this in a very dedicated way. Even when you're doing systemic. Okay, let's start with systemic now that we are done with immunology and HIC. Next is your systemic. Okay, so your college will probably go section wise because according to the CBME curriculum, that is what it is like. So go section wise like the college is, but at the beginning of every chapter, look at this classification. Okay, let's say your skin chapter, your section skin. Okay, skin has your bacterial infections. The first one is staphylococcal infections. Okay, so what you do is you go back, look at this, look at where staphylococcus falls. Is the gram positive cocci? What are other gram positive cocci? And then you just stop at that. That's it. Just look at that, and then you start reading about staphylococcus. Just look at the classification, and then let's say the next chapter in skin is staphylococcus, then it is streptococcus. Okay, so staphylococcus and streptococcus are here. Now both of these are gram positive cocci. When you're done with both of these, correlate those lab diagnoses. Look at what is similar, what's different, so you can see what gram positive cocci in general have in their lab diagnosis, and for specific staphylococcus what are different tests. Okay, so that will help you a lot to memorize those particular things. Okay, so correlate the lab diagnosis, and obviously this is unsaid. Look at the diagrams and tables. Look for correlations in similar organism in other chapters. So by this I mean, let's say you are studying staphylococcus, you have done it in skin. Now once you are done with that section, look at these. Look at what other chapters is staphylococcus present in, because like I said, our textbook is system based, it is not organism based. But when you're doing a particular organism, please go and look at what other things the same organism can cause, and the page numbers are given here as well, so it will just be easy for you to do it from the beginning of the year rather than breaking your head at the end of the year. So you will be ahead of everyone in the subject if you do this particular thing. Okay, so look for correlations and look for this, and then make flow charts per chapter of causative organisms. So let us say again skin. I have already said that in bacteria there is staphylococcus, there is streptococcus, and then there's Clostridium perfringens. Look at the index, you'll understand what I'm talking about. So let's say you're trying to make a flow chart. Let's say you write skin and soft tissue infections, and then you write bacteria. Then you divide the bacteria into gram positive bacteria, which are bacilli, gram positive cocci, gram negative bacilli, gram positive whatever, and then you write in skin what gram positive bacilli are causing what infections. Okay, so make such flow charts per chapter for causative organisms. How is this going to help you, you may ask? Because it's going to help you in your viva. Firstly, it's going to be at the tip of your tongue whenever someone asks you what this organism does, and it helps you a lot in medicine to eliminate different organisms. Okay, so systemic, once more, go section wise like the college is going. at the beginning of every chapter, look at this classification, correlate different lab diagnoses of similar organisms, look at all the diagrams and tables, and look at the look at the organism and which chapters it is occurring in, and at the end, make flowcharts per chapter of all the causative organisms. Now, by the end of the year, you will complete all your systemic chapters, from your bloodstream infections to your urogenital tract infections. So what I personally did was that I then read all the bacteria together, all the bacteria of blood, respi, GIT, in a sequence together. I read all viruses together, all parasites together, all fungi together. This is optional. You can do this if you want to, if you have time, but I would suggest you to do this once. In bacteria, focus on the lab diagnosis, the types of bacteria, the viruses, look at the shapes, and parasites, all the different types of life cycles, their structures. So what this helps in is correlation, again in memorizing and all the lab diagnosis. Now, one more important thing that you need to do is, at the end of the year, relate treatment with your knowledge of pharmacology. Now, like I was saying, when you are studying systemic, let's say again, because I'm using this example, Staphylococcus, what the textbook will do is, first it will talk about the organism, what type of organism it is, what causes its virulence, what are the virulence factors, and then it will get onto the lab diagnosis, how to diagnose a patient, let's say, who has this. At the end of this will be the treatment. Now your treatment is obviously pharmacology related. Now by the end of the year, you'll have your knowledge of pharmacology, you'll have an idea of all the antimicrobial agents. So at the end, relate your treatment with your knowledge of pharmacology. It is going to make so much sense, trust me. And also please focus on vaccinations. This is going to help you in your community medicine in third year SPM. Okay, and then I'm planning to teach microbiology. So this is going to be my plan on how I'm thinking of teaching micro. So first I'm gonna do the basics with the antibody antigen reactions, then system wise with organism classification in the beginning, like I showed you guys, and at the end I'm planning to do an organism wise summary, like a video on all bacteria, video on all viruses, and I'm gonna be making a playlist of all systems, and then all bacteria, all viruses, and so on. And maybe I may make videos on immunology and HIC. So if you want to watch these, you definitely can. And yeah, I hope this helps. All the best, study well, and enjoy your second year. That's it. Thank you so much for watching this video. Please subscribe to this channel and share this video with your friends who need it. Bye.